So let's try to get Antonio from EFE. Antonio?
Sí, hola, buenas tardes. Quería preguntar a los expertos de la OMS qué opinan del hecho de que los gobiernos de Estados Unidos y Brasil sigan promocionando el uso de hidroxicloroquina en el tratamiento contra la COVID-19, pese a que la OMS ha detenido los ensayos clínicos con este fármaco.
So maybe I can start. So the WHO's Solidarity trial has 4 treatment arms compared to the standard of care, and one of them is hydroxychloroquine. So the week before last, there was a publication that came out, which was an observational study in a large number of patients that concluded that the risk of death is higher among COVID-19 patients who received hydroxychloroquine or chloroquine, either alone or in combination with a macrolide antibiotic, compared to those who did not. As you know, the Solidarity trial is governed by a steering group, and the executive committee met urgently to consider the implications and decided that while the Data Safety Monitoring Board is looking at the data from the trial, that it was safer to protect patients from any possible harm to actually temporarily suspend enrollment into the hydroxychloroquine arm of the Solidarity trial. So it was a temporary suspension. The Data Safety Monitoring Board is looking at our own data, and we should have that information within the next 24 hours or so to make a decision. Meanwhile, we do know that there's another large trial going on in the UK called the Recovery Trial, which has enrolled more than 11,000 patients. Their Data Safety Monitoring Board looked at the hydroxychloroquine arm versus the standard arm and did not find anything to concern them. And they are actually continuing with their enrollment. So to answer the other question of countries using hydroxychloroquine, we have always believed that it's important to generate data on safety and efficacy of any of these treatments. Because this is a new disease, we do not have the evidence. We want to try, of course, treatments as quickly as possible, but the best way and the only really robust way of generating evidence is to do well-designed randomized trials which enroll enough patients to make a definitive conclusion on safety and efficacy. Hydroxychloroquine has been proposed both for the treatment and for the prevention of COVID-19, but really we need to wait for results from the randomized trials to know whether it's effective in either or both situations. Until then, doctors who are prescribing it do so basically under a sort of a compassionate use protocol, which needs to abide with the laws and the regulations of the country concerned. But we hope that the trials that have already started will continue to enroll and will be able to answer these questions definitively, because that's going to be really, really important. Thank you.
So if I could just add something, not specifically on the hydroxychloroquine, I just want to point out that while the world is looking for therapies, looking for antivirals and other therapies specific for COVID-19, there is supportive treatment that is available for patients. And I think that's an important message that we need to continue to push out, because people with pneumonia, people with severe pneumonia, people with acute respiratory distress syndrome, people with septic shock, people who need oxygen and respiratory support, we have guidance that's out to work with clinicians where we've learned from frontline clinicians who are dealing with COVID-19 patients and how they're dealing with patients now before we have that treatment. We want the treatment, we want a safe and effective treatment, and these clinical trials are underway. But until we have that, there is some supportive care that is out there and that clinicians can use. In addition to that, we are working with ensuring that healthcare facilities and health facilities have the right equipment to be able to care for patients depending on the severity of their system, to build treatment centers in areas that don't have treatment centers. And so there's a large amount of work with huge teams that are trying to build treatment centers in countries that don't have those, so that they can be used for COVID-19 patients and any patients that need care. We're working to supply oxygen to ensure that oxygen can be available to people who need it across different countries. So I just wanted to add that to say that while we are working hard to accelerate the knowledge around safe and effective treatments, there are supportive treatments that are out there, and we're working with clinicians worldwide, listening to them, learning from them, putting out guidance, doing training, so that there is care that's out there in the meantime.